EKG Tech. This is the outline we're going to follow for the EKG Tech manual. We are going to cover cardiology terms, anatomy of the heart, physiology of the heart, conduction system of the heart, 12-lead EKG hookup, normal rate and rhythm of the heart, lethal rates and rhythms of the heart, steps to performing a 12-lead EKG, which are retrieve the medical record, review the order, perform the EKG, document the procedure, escort the patient back to the exam room, and let the physician know that the patient has been completed. Cardiology terms: deoxygenated blood, low or no oxygen in the blood, and the color is blue. Number 2, oxygenated blood. It's oxygen-rich blood, and the color is red. Atrium, upper chamber of the heart that receives blood, and you have 2 of them, and that's number 4, atria. It's the plural for atrium. It means both chambers. Ventricles are the lower 2 chambers of the heart, and they receive blood from the atria. Veins, blood vessels that carry blood to the heart. Arteries carry blood away from the heart. Baseline, normal for the patient. Conduction system is the electricity flowing through the heart to produce each heartbeat. AV stands for atrioventricular. Tachycardia means fast heart rate. Bradycardia is slow heart rate. Inferior means below. Superior is above. Lateral means side. Posterior is the back. Anterior is front. And the word coronary means heart. Anatomy of the heart. As you can see, you have 2 upper chambers. It's the right and left atrium. And you have 2 lower chambers, the right and left ventricle. As you can see, on the right side of the heart, the blood is blue. On the left side, the blood is red. On the right side, you have deoxygenated blood, which means oxygen-poor blood. And when it goes to the lungs, it picks up oxygen and comes back into the left side of the heart. And that's why it's red, because it picked up oxygen from the lungs. We've already talked about the anatomy of the heart, which is the structure of the heart. Now we're going to talk about the function of the heart. The heart has 2 main functions. Roman numeral 1 is blood flow. Roman numeral 2 is conduction. So we have blood flow and conduction. Let's look at blood flow. It supplies oxygen to all the organs in the body through this process. Step 1, the superior and inferior vena cava carry deoxygenated blood back to the heart and deposits the blood into the right atrium. Then the right atrium squeezes blood into the right ventricle. The right ventricle pumps the blood through the pulmonary arteries. Remember, arteries take blood away from the heart, and that goes to the lungs. That's where it picks up oxygen. If you think about when you're breathing in oxygen, you're breathing out carbon dioxide. Your lungs are filtering the oxygen for you. So when the pulmonary arteries take blood to the lungs, it brings back the oxygen-rich blood back to the heart and dumps it into number 4, which is the left atrium. Number 5, the left atrium pushes the blood into the left ventricle. Then the left ventricle pushes the oxygen-rich blood out of the body through the aorta, which is the largest artery in the body, and it goes to all the body organs. When the oxygen supply in the blood has depleted, it turns blue again, and it comes back to the heart through the veins into the vena cava and dumps again into the right atrium, and the process starts all over again. Conduction. The conduction system produces electrical shocks to the 4 chambers of the heart in order for the blood flow process to take place. Now let's explain that. The first electrical shock is produced by the SA node. That's the heart's natural pacemaker. And if you refer to page 6, it has a nice picture for you. You can actually view page 6 along with page 5. So once again, the first electrical shock is produced by the SA node, which is the sinoatrial node. This is the heart's natural pacemaker. The SA node fires an electrical spark into the right and left atria, which shocks the atria. If you've ever been shocked by an electrical fence, you touch the fence, it shocks you, you tense up. The same thing with your heart. Your atria receives the electrical shock from the SA node, and then they tense up, and that squeezes the blood into the ventricles. The second electrical shock is produced by the AV node, which is your secondary pacemaker. The AV node receives an electrical spark from the SA node as well, which causes the AV node to fire, and it sends an electrical shock down through the bundle of His into the right and left bundle branches, and then it travels all the way to the Purkinje fibers, which are called the roots. That whole process sends the electrical shock to the heart muscle, which causes the ventricles to contract, and that forces the blood out of the ventricles into the rest of the body. So the atria contract at the same time, and the ventricles contract at the same time. If they don't, then you have a conduction defect or a conduction delay, and that is what causes arrhythmias, which are abnormal heart rhythms. And all of those can be identified on the EKG. You do not see blood flow abnormalities on an EKG. You only see conduction system abnormalities. So we're not talking about blood flow when we're talking about an EKG. We're talking about electrical conduction.